Me gusta el movimiento de Nueva York y eso, pero se siente solo. O sea, porque si me hubiese venido con un familiar es diferente, platicas, pero aquí yo estoy sola. Ahorita que estoy haciendo amistades así, pero no es lo mismo que vengas con alguien de tu país, que ya te conozca desde pequeña o algo. Aquí no, aquí estás solo, encontrándote lo bueno y lo malo. Pero para adelante, todo es para adelante.
Mi hijo, el mayor, él se está ahogando. Él se me lo estaba llevando el río. Estaba la corriente bien fuerte y él se me lo estaba llevando y uno como madre en esa desesperación no sabíamos qué hacer. Mi esposo, perdón, pero no me gusta recordar ese pedacito.
While her husband was able to pull him to safety, the fear is still fresh in her memory, as Jesus del Carmen Sosa describes attempting to cross into the United States from Mexico. Carmen left her hometown of Esmeraldas on the coast of Ecuador with her husband and 5 children in the fall of 2021, fleeing the violence that has plagued her country in the last decade. They arrived in New York City early last year and are still trying to find a foothold in their new home. Today, she has come to Bellevue Hospital with shoulder pain.
Y como mi esposo todavía no tiene un trabajo fijo para poder pagar un sitio donde llevarnos, entonces eso me desespera, me da ansiedad y desde ahí vengo con un dolor en toda la parte de aquí del hombro. Me duele mucho. Tengo 4 días así.
Like Carmen, more than 140,000 migrants seeking asylum have arrived in New York City over the past year and a half. Finding housing, work, and providing health care for these immigrants has been one of the biggest challenges facing the Adams administration.
As a healthcare provider, seeing the number of people come to New York City and the needs that they have, this is the definition of a crisis. People have been through multiple crises themselves, making their journey up here. We hear about children that have had to step over dead bodies. We hear about the trauma that parents have experienced. When people come through the front door of our arrival center here, people look scared.
Dr. Ted Long is the Senior Vice President of Ambulatory Care and Population Health at New York City Health and Hospitals, the largest public health care system in the U.S. Long has been tasked with leading New York's response to the influx of migrants. The Roosevelt Hotel serves as the city's main intake center for homeless migrants. New York One got access inside, where asylum seekers are screened for a variety of illnesses and diseases, such as COVID, tuberculosis, and chickenpox. Once here, they are reminded that no matter their immigration status, they will receive medical attention at no cost. Long says up to 500 people can walk through the door looking for help on any given day.
Everything we see here has been designed by New York City Health and Hospitals. We have doctors like me that are in charge here, and they put together the array of medical services based on what we saw asylum seekers or our patients needed.
One thing that stands out to those providing treatment is the large number of patients who have not had access to regular care, especially preventive care like common vaccinations. Long says the staff at the Roosevelt and other humanitarian centers have given over 50,000 vaccinations so far. Those vaccines are also a prerequisite for parents like Carmen, who have enrolled their kids in public schools in the city.
I assume you're working closely with the Department of Education as well, because a lot of these kids also will end up going to school, right? And there are certain requirements to go to school.
If you ask their family why, they haven't had the opportunity, or sometimes they're so expensive there that the family couldn't afford it. Here we fix that immediately upon arrival to New York City.
Despite the large number of recent arrivals, Long emphasizes that this has not put a strain on the system. The numbers bear this out. There are close to 6 million outpatient visits a year at New York City Health and Hospitals, and so far, the number of migrant visits over this period of time has not exceeded 70,000. Screenings for depression are another important component of the healthcare services provided to the new arrivals. Masha Slavin is a primary care physician at Bellevue Hospital who has been working very closely with immigrant families and now those seeking asylum. She says it's not surprising to find so many of them suffering depression after their traumatic journeys.
Everyone who walks into our clinic, they're getting their blood pressure checked, but they're also getting a depression screening test. People have had really challenging situations in their home country, often have had a very difficult journey.
Those experiences, especially in the Darien jungle, still haunt Carmen and her children. She says she's in the process of setting up appointments for her and her kids to speak to a mental health specialist.
Y decirme, mamá, pero ¿por qué hicimos esto? ¿Por qué nos metimos acá? He sentido la necesidad por todo lo que estoy pasando ahora, de regresarme, pero me pongo a pensar todo lo que sufrí con mis hijos en esa selva. Los arriesgué, casi se me muere mi esposo, mi niña, y eso me mantiene aquí todavía, luchando por un futuro para mis hijos.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.